Okay, let's turn to one of our healthcare customers to learn how they partner with Salesforce to serve and care for their customers in a whole new way. I'm Carolyn Bathauer, and I am pleased to be joined by Dr. Paramjit Romi Chopra, the president and CEO of the Midwestern Institute for Minimally Invasive Therapies, or MIMIT Health. Dr. Chopra, thank you so much for joining us. We got a chance to chat before, so I'm very excited for this conversation. But tell us how you're using Salesforce at MIMIT. What has your journey looked like?
Yeah, my journey started many years ago, almost over a decade, just looking for some simple CRM solution. Tried some of the other ones, the server-based thing, and found Salesforce and haven't looked back.
That's great.
And our world is, our mission is, we say, put the care back in healthcare.
Yeah.
It's about putting the patient at the center and helping people lead their best lives. And the biggest challenge is managing the data, the information, the knowledge you get from it, and the actionable insights or wisdom that you get from it. We've been able to take Salesforce as a platform and connect just about everything. So from patient acquisition, where we don't even know where people are, raising awareness, marketing cloud, we've used that. We do patient 360, we do provider 360, we do payer 360. We actually manage all the patient's journey. We've actually built a very comprehensive patient management platform. And the EMR is a source of truth for medical records. But we've used Salesforce and all the other affiliated things to be kind of the source of truth for engagement and management.
That's wonderful.
And it's been fantastic, to say the least.
Yeah,
And
well, you mentioned you looked for a simple CRM solution and have built what you've needed on
Yes.
Salesforce, so that's pretty incredible.
Yes, and actually we've gotten to a point where, geez, we've got MuleSoft, we've done the interoperability. We've done it, what I love about Salesforce, we've done it in a way, organically of course, but Salesforce is such a powerful enabler.
Yeah.
And it teaches us, it helps us, it's been fantastic.
So we're a true partner.
Absolutely.
Yeah.
Absolutely.
I love that.
Yeah, so much so that actually we've taken all of what we built, learned, we just spun it off into essentially a partner company now. It's a management service organization called CIMS, C-I-M-S-S, and we've been able to now bring this to other customers. So we're SI partner, ISV, OEM, OSB, all the acronyms you have.
So you went from customer to now building your business on Salesforce. That's awesome. So you mentioned two things, electronic medical records, and then also being able to have a full patient 360. What has been the reaction of your patients? Because I know as a patient, when I walk into a facility and all of my doctors are working together and make the best care for me, it is absolutely a game changer.
Yeah.
So what's some of the reactions you've been getting?
They love it.
Yeah.
I have patients of mine, I still actively practice. And as I face challenges, I will have the dev team start solving problems. And one of the things that patients just love this, because I call it omni-channel healthcare delivery, which means home, clinic, hospital, nursing home, digital telehealth. We have patients all over the world, actually. Second thing after that is we do omni-channel communication. They can text us, email us, all on the platform. Yeah. They can do live chat, etc. Then after that, we provide omni-channel marketing. They can, and we have contact center, etc. We do omni-channel service. Yeah. So the patients love it, the families love it. We track the household. Now, a lot of the conditions we treat are chronic conditions. Sure. So here's a classic example. I get referred a patient from a doc, and this guy can't walk too far. He's got peripheral artery disease, he's got blockages. And now he will go on these walks. He has his, he tracks his distance. He texts us, they go on the platform. It's part of what we call chronic care management. We use Slack. Every patient has a channel that from the internal team to manage them. But we now have patients who will get their private individual Slack channel. It's HIPAA compliant.
Amazing.
And they can communicate with us immediately on the fly.
That's wonderful. And then they're taking control of their care as well,
Absolutely.
right? And so it's a partnership with your patient. So it sounds like you're doing a lot end to end, and you're managing your patients, and the people that are managing that for you. Help us understand how Salesforce helps augment for your care teams. Any stats you can share with us?
Oh, first of all, we emulate Salesforce all the time. I've been lucky enough to meet Mark Banahoff a bunch of times, your leadership on several boards. And I know a lot of Salesforce employees and people. So we use V2 Moms. We've got my trailheads, when it first started. We now have learning enablement.
Yeah.
Anything. Salesforce does a lot of sales work, and they call it sales enablement. But what am I selling? I'm selling care.
Yeah.
Not in terms of commercial, but that's the product. And so I use those principles, and our team loves it. Everybody's on the platform. If it's not on Salesforce, it didn't happen.
Yeah.
And then all the data is structured. We use all of this where it lands up in Data Cloud. We got MuleSoft working. We are harmonizing data. We've unified profiles. We are segmenting that to get going into Marketing Cloud. Patients are on journeys, vendors. We even have accounting on top of it.
That's awesome.
I could go on for a minute.
Well, you're doing so much, and one of the big things, and so the last question, we're talking about AI. So are you starting to think about how you'll use AI, what it can do for your practice? Share with us a little bit about that.
So we already are.
Okay.
And
Awesome.
so one of the first things, all of us as humans are patients first. Prenatal care, postpartum, you can't be born by yourself, you can't bury yourself. So everybody needs care, and there's all the data that is required. It has to be in healthcare, the biggest problem is they're in silos and a lot of garbage. Garbage in, garbage out.
Yeah.
No matter how good your model is, with garbage, it'll give you garbage out.
Sure.
So the first thing we've done is we've made sure that our data is very good in the first place. And the second thing we've done now, we're already using AI in bits and bytes. And I tell people all the time, see, AI is just another tool. There was electricity that came in.
Yeah.
Blah, blah, blah. This is going to be that.
Yeah.
It's going to change the world. It's going to empower us. But in the end, it's about every human being living as long as they can and having a great quality of life. So we've started already using AI within our platform. We're on the platform already. Now we're trying to find use cases one by one that it actually helps patients live longer and have a great life.
That's incredible, because now you're talking about how technology can improve the quality of life through those interactions with their doctors. It's awesome. So thank you so much for being here. Super insightful. I have a feeling there's going to be a lot of people reaching out about how you're doing these things. So we really appreciate it. So there you have it. Salesforce and MIMIT Health collaborating to deliver the best customer experiences. Dr. Chopra, thank you again for joining us.
My pleasure. Thank you indeed.